Good afternoon, everyone. Thank you for joining Johns Hopkins Government and Community Affairs Showcase Series conversation. The Showcase Series highlights various components of the Johns Hopkins institutions that may be unfamiliar to many Marylanders. The series is also a forum to discuss relationships the Showcase program has with Maryland. I'm Mark Chang. I'm a member of the Maryland House of Delegates representing Anne Arundel County. And on behalf of the House Appropriations Committee, it is an honor to be able to moderate this afternoon's presentation. Today, we will be discussing the Johns Hopkins University School of Nursing with the school's newly appointed Dean, Dr. Sarah Szanton. Dr. Szanton, thank you very much for being here this afternoon, along with the Associate Dean for Community Programs and Initiatives, Dr. Hae Ra Han. Congratulations on your new role, Dr. Szanton. During this conversation, we will also hear from Dr. Han about unique community programs run by the School of Nursing. We'll also be able to get a special look into the newly renovated Pinkard Building, the primary facility that houses the Johns Hopkins University School of Nursing. This project, which received $4 million in grant from the state of Maryland and other remarkable philanthropy, has resulted in a complete renovation of the school. The dramatic transformation of the face of the building and the new entrance is stunning and achieves the goal of a more welcoming and inviting place for students, faculty, and the community. Before we get into discussion today, I wanted to go over some logistics. This webinar will be recorded and will be posted on the GCA and Hopkins at Home websites. Additionally, questions and answer function has been enabled during this webinar. So please feel free to type any questions there. We'll also do our best to respond to as many questions as we can during this time available. With that, I'll ask Drs. Zahn and Dr. Han to tell us more about the School of Nursing with the program overview. Thank you.
Thank you so much, and thank you for the warm welcome. Thank you to everyone who's joining us today. We are thrilled to talk about the Johns Hopkins School of Nursing's impact on Maryland and also the funds which we are so lucky to receive from Maryland. As was mentioned, we have a new building and renovation. I'm going to show you beautiful pictures in a minute, but just to underscore, it's 36,000 square feet that's new and 30,000 renovation. We did get a $4 million state grant. There's expanded learning and event space. It's a welcoming, open, transparent, you'll see in a minute, a lot of dedicated research space. We focus very strongly on the student-centered nature of the building in terms of enhancing collaboration and social areas. And a nice feature is that a lot of the rooms are named after Baltimore neighborhoods like Hamden or the other neighborhoods, Patterson Park. We've got flexible learning space. Everything is on wheels and casters so that things can move around to create flexible learning spots. And we have a really interesting and exciting cutting edge technology where students can learn virtually as well as in the clinical sites. So this is our, you can see it's mostly glass, the renovation. And this is the atrium where you walk in. It's 2 stories of beautiful opening out into the community. That's the nursing pledge on the side. This is a second floor. You can, and this is what I was talking about, this space can be designed all kinds of ways because everything's on wheels. And now I'd like to introduce Dr. Hae Ra Han to talk about the Center for Community Innovation and Scholarship.
Thank you so much. So this is Hae Ra Han. I was officially coded for saying I want to do teach and research here every day because of our beautiful building and the gracious space over there. I'm happy to present our mission of our community programs, and it is mainly to promote the health and well-being of our underserved populations in Maryland by working with our community residents, Johns Hopkins medical institutions, and other vested university groups, as well as community-based organizations. Our methods are to involve our scrub nursing faculty and students in nurse-led community care, service learning, research, scholarship, and advocacy. You can go to the next slide. So our programs have been embedded within our community, integrated within our community ever since 1994. And you can go to the next slide.
Oops. I'm sorry.
And our work began with the idea that working with our residents in our communities where social determinants of health are pronounced more community, so that we provide more community-facing, community-focused endeavors that are needed to make a change to the health and well-being of our community that we serve. So as you can see in this particular slide, this is the report that I pulled from the past 5 years. We function across different divisions and places. Here from the top, we have Henderson Hopkins School. This is a K-8 Baltimore school that is managed by the Johns Hopkins University. And we provide health education and health counseling across the students, families, and teachers and staff there. So over the past 5 years, you can see the encounters. That is more than 3,000. To your right, clockwise rather, we have Walt Community Nursing Center that is located on 901 North Broadway. And you can also see the number of encounters that happened over the past 5 years. So here we provide a lot of consultations as well as case management addressing some of the social determinants of health. The center opened back in 1994. This was the first nurse-managed center across the university, and we also provide barrier-free health and wellness programs. One of our latest programming is called Ask a Nurse, which is a comprehensive care referral and health consultation service. Down there, that is Date the Market, which is one of our recent innovations in collaboration with our partners at the School of Medicine. We provide a market-based health screening, counseling, and most recently, blood pressure screening. And at the bottom, that is called a community outreach program in collaboration with our partner over at the School of Public Health named SOURCE. So SOURCE is the service learning center that serves our students across the university. We place our students through this COP program in a variety of health agencies and community agencies throughout the state of Maryland, especially in Baltimore. And over the past 5 years, we had more than 200 students serving more than 5,000 service hours across more than 100 community organizations. And then to your left at the bottom also, there is a program called Birth Companions. Over the 5 years, a total of 384 new birth companions were educated, and through this program, nursing students actually attended a total of 672 births across the state of Maryland and DC areas. Our partners for this program include International Rescue Committee, Family League, and Baltimore Health and Medical System. And then right next to the Henderson Hopkins from the top, the place is called House of Ruth. So here we provide shelter-based nursing care and health promotion services. And our scrub nursing community nurses there provide physical and psychosocial assessments to women and children in transitional housing. And we also help women there to navigate the healthcare system for their necessary follow-up care. We, over the 5 years, provided more than our services to more than close to 800 women and their children. Next slide, please.
Okay. Switching back to me and my programs. So we have developed a program called Capable here that is a method of helping older adults age with independence and dignity in their own homes and communities. It's 4 months long, and it involves a handy worker, a nurse, and an occupational therapist. And it costs a little less than $3,000. And we've been able to cut people's disability in half. People have gone from not being able to leave their house to being able to engage in community events, from not being able to bathe and dress to being able to do those. as I said, it's a combination of nursing and occupational therapy over the 4 months where people decide what their own goals are. They want to be able to walk to the mailbox to get their mail. They want to be able to sit on the back stoop and listen to the birds. They want to be able to remember to take their blood pressure pills. Whatever it is that matters to them is what we do. It supplements primary care. And what's very important in it is the older adult is the expert. So instead of us coming in and saying, here's what you need to do, and we're going to screen you for this or that, it's all based on the person's own goals and increasing what we call their self-efficacy. We've been able to increase their physical function, reduce depression, and it leads to fewer hospitalizations and nursing home admissions. In fact, it pays for itself 7 times over. And we have had great investment from multiple partners. Let me just give you a little case study here. So remember I said that the person themselves comes up with their goals. So Mrs. R's goal is to prepare meals more easily without shortness of breath and pain. And currently that was hard for her to do. And so the handy worker lowered the cabinets, and in Baltimore, the handy worker comes from Civic Works, which many of you may know is a great institution. And so this way she can sit down to cook. And we organized her spices with her so that it takes less energy to find them. And there's a reacher here you can see that gives her better control when picking up items, and a mirror that's tilted above the stove so that she can cook and see the food in the pots and the pans while she's seated. These are all very common sense approaches, but they're a combination of the nurse and the occupational therapist and the handy worker working together. The nurse in this case also worked on her shortness of breath and her pain as well. And so now she can cook what she wants, seated and without the shortness of breath and pain. So that's just one tiny example. There's as many goals as there are people, which is the kind of the magic of it, because there's not a one size fits all. It's all about what the older adult wants to be able to do. We've served 984 people in Maryland so far. That's been a combination of research dollars and now money comes from Johns Hopkins Hospital to provide capable to people so that they can have independent and dignified lives and avoid hospitalizations. And the all payer waiver plays into that, if we can get into that when we have the discussions. So that's the end of our presentation, and we're excited to answer questions.
Thank you very much, Dean Szanton, also Dr. Han, for the very informative presentation. To both of you, how has the program impacted Maryland?
Do you want to start, Hae Ra?
Sure. So as I mentioned through my presentation earlier, we have made a significant impact on the lives of the residents in Maryland by providing direct services, health promotion activities, and really engaging our partners throughout the whole process. Our students learn, as well as our community partners are also engaged in the process. Our community programs, I will say, it's really the umbrella for all of these different activities addressing education, health promotion in our community, and service learning. And also a lot of these activities from the higher education perspective can be put into a lot of evidence-based reports that have been published throughout so that other schools and students can learn from the process and our projects. So I will say this is just one prime example as to how our community programs have impacted across the board.
I would also add that a lot of times our students come from out of state and then they stay here. And so we a lot of students, start their nursing careers here in Maryland and often stay for decades. That was true for me as an example, and might be true of Hae Ra as well. So we're also building the state's workforce. And I also wanted to mention that the state gave $1.2 million through the Innovate Fund that we were able to match with a donor that created a really innovative endowed chair, Dr. Craig Pollack, who is focusing on the relationship between housing and health and mentoring students in those veins to be able to better to support policies to improve health by focusing on housing.
Great. What would be the future goals or plans of the School of Nursing and its impact on the community?
Dr. Han?
Sure. Yeah, so we will continue making all these endeavors to address health inequities, social determinants of health throughout a variety of programmings that have been highlighted. Some of the things that our community team is planning to do more is the dissemination of easy to read and understand health information through non-traditional social media. So far, a lot of our efforts have been in the actual delivery physically, virtually, but at the same time, there are a lot more we can do so that we can really publicize a lot of important health information. And we feel that those non-traditional media nowadays has been utilized a lot more than before, could be a great resource for our Maryland residents, as well as our students and faculty. And we're also trying to promote this technology integrated nursing care for health promotion and wellness. Through this pandemic, we learned a lot, especially in terms of telehealth, even though telehealth has been in place more than a decade, but I believe pandemic really expedited this progress of the telehealth integration into our healthcare system, as well as our education as well. So we will make sure that technology integrated nursing care is utilized much more for health promotion and wellness activities we do. And then also we will continue our efforts to develop and evaluate reimbursable nurse-led community programs for health promotion also, which eventually I hope can lead to health equity.
Great.
Great. Well, throughout the years, Johns Hopkins and also the state of Maryland has had a strong partnership in serving the residents of Maryland. What policies or resources could the state provide to make this project or program more successful in the future?
I'm happy to jump in on that. So yes, the state is a fantastic partner, always has been. And the MDPCP program, the primary care program, focus on population health, we see as a great opportunity to have nurses be leaders in primary care teams across the state to increase the population health and decrease health disparities. We also, with the all-payer waiver that the listeners are probably familiar with in terms of hospital payment, leads to so many opportunities for hospitals and health systems to invest in the community. We see that will likely grow. And we're also hoping that the state Medicaid program will include payment for things like capable and other function-focused care, so that older adults who are low income and receive Medicaid are able to age with dignity and independence.
And if I may, one more to add there, all the great sort of resources and needs. I think addressing integration of all the technologies for our educating nurses will be another great place to consider. We use virtual reality, augmented reality, and that has been proven to be really effective in educating our nurses across different health topics. And I think at the state level, investing in supporting those technology-driven education will be another important aspect to consider as well.
And another one is our students get loan repayment if they become nursing faculty in the state. And that is wonderful for a lot of reasons, one of which is, the listeners may have heard about nursing shortages that are happening. And in large part, those also are because of nurse faculty shortages, that nursing schools like us and Maryland and Towson and the other great nursing schools in the state turn qualified nursing applicants away because there's not enough faculty to teach them. So the investments that the state of Maryland has done in loan repayment means that a strong nurse can go back to school mid-career to get a PhD or a doctor of nursing practice to be able to be nurse faculty without, putting a second mortgage on their home. And so that's been a huge investment. We hope that can grow as well.
Thank you very much, Dean Szanton and Dr. Han, for sharing just all the synergy that occurs between the collaboration between the state of Maryland, Johns Hopkins. In addition to all that was mentioned already, what other policies or resources have made your programs more successful?
I want to say our community support and collaboration that has been really one of the most significant impetus to our success so far. We will grow more. However, I really appreciate all of our community partners throughout these years. I, as an individual researcher also, even beyond this community program and my current role as Associate Dean for the community programs, really witnessed a lot of great support and resilience and strengths that really create a lot of synergy for student learning and the success of our programs. Even as a small example, one of the programs we are implementing right now at the Northeast Market through the Day at the Market program, we work closely, collaboratively with the vendors within the market, and unless their approval is there and then their support to create some of the rooms for providing health screening services and other vaccination clinics there, none of these could happen. So I would appreciate and want to make sure that we acknowledge their support throughout these years. Hopefully it'll continue and in a bigger and wider fashion as well.
That's great.
Great, thank you. At this time, we want to thank all the viewers who are watching this for participating in this informative conversation. And we will at this time take questions from viewers. So if there's any questions that the viewers have, we will at this time address them. And we have a question from one of the viewers, and that is from Billy, and that is how do you build programs in a collaborative way with the communities you work with?
Well, I'll start with that, and then I'm sure Hae Ra will jump in. I think there's a lot of answers to that, but I think it starts with what does the community say it wants and say it needs, and then listening first, and starting to develop something and making it iterative, meaning going back and back and back to community members, perhaps with an advisory board, or having them be more official collaborators in research. What Hopkins excels in is developing through research and then trying to scale it out of research to impact people's lives. And that's part of why I mentioned capable. It started with research with a small pilot program, and we've developed it. And now it's nationwide, small, but it's in 45 places across the country. And so part of the way to do that, to answer back to the question, is to see what the community wants, but also the people who have the power to grow something, what do they need also? So that the policymakers, the state, legislators, hospital systems, health systems, what problems are we trying to solve for so that something can be sustainable? Because usually programs aren't free. So trying to close that loop between the need and what can sustain it. And programs like the all-payer waiver can really help with that sustainability. For example, if a program could help keep people out of the hospital. And I'm sure Hae Ra has other answers as well.
Sure, just to add to what Dean Szanton just described, I think working with our partners across the board, is really important. One of the programs that we offer and deliver for free right now is called a Passport to Freedom, which started out as a simple stress management program. However, it is embedded within one of our sites, House of Ruth, for example, which is one of the transitional housing facilities in the state of Maryland, to really provide this mental health focused mindfulness and stress management all around program, and nurse management referral services as well. So I think some of these programs with further evaluation and input from our participants, we can really grow into something that is meaningful and useful for larger populations as well.
Wonderful. And from Carrie's question is, what other policies or resources would be most useful in the future?
So I'm assuming this is about health. Yeah, that's a big question. I think Maryland's kind of come close to there being a single payer. I think that would be a big step to, if we were like Vermont or Hawaii, where not just for hospitalizations, but in terms of across the board, all the payers were all in terms of population health. Another answer would be like Washington State or also Hawaii to have a long-term care services policy. So just to explain that, as we get older, unless we're really wealthy, if we have some kind of need for help, we just can only rely on our family. And then eventually, if we're either low income or become impoverished by trying to take care of ourselves, we could be unmedicated in a nursing home, but just about nobody wants to live in a nursing home. So some states like Washington State and Hawaii have started a long-term supports kind of program that when you're older, if you need help with bathing or dressing, it's there for you. And that would be a big bonus for our aging population. And as most listeners probably know, there's as the baby boomers get older across the country, there's 10,000 people turning 65 every day, and that will be true for the next 10 years or so. So I would see that would be a great thing that the state of Maryland could do.
And something along the line, I think a bit of more innovative, looking at the scope and practice of nurses and nurse practitioners. I want to highlight this successful pass of the new law that came in effect back in year 2020 through the CARES Act that allowed nurse practitioners to have this order authorization for home healthcare services for Medicare patients, which used to be in the realm of physician only. So something like this, within the segment of community health overall, we know that the majority of chronic care, for example, happens in a community setting than in a hospital setting. And nurses do a lot of health promotion and chronic disease management activities. If there is some policy that allows all these scope of practice work in a much more versatile way, then I think there will be more innovations, and hopefully that'll eventually lead to better health outcomes. And we already are seeing some of those evidence to talk about the impact of nurse-driven or nurse practitioner-led home health programs and other segments of health outcomes with a positive impact. So I definitely would love to see more of those activities and initiatives to take place.
Question from Annie: are students required to participate in the community programs that were presented here this afternoon?
That's a great question. I'd love to answer that question. So I will say Hopkins School of Nursing, early on, many of us felt the need for working closely with our community. Any student who comes through our program understands the city of Baltimore, the history, health inequity, social justice issues. Several years ago, we created this program called Community Outreach as an elective course. Starting about 3-4 years ago, we then made it a required core course. So all of our students at the master's entry into nursing program, because we do not offer a pre-licensure program at the undergrad, all of our education at the pre-licensure level, at the master's entry level. So students who come to our master's entry into nursing program within the very first 7 weeks of their program for 2 years study are required to take this community outreach as a core course, 1 credit. Students are required to go out to the community. They sign up different areas, and then as a group, they then conduct the community assessments, and then asked to talk to one of the community agencies within the geographic area they choose, and then provide or develop a community report, which then eventually is required to be presented as part of the class activities. After that is done, this is optional then. After everybody completes their required core course, people then are allowed to sign up to participate in the community outreach program. So for those students who sign up for the community outreach program, they get paid for their work. However, by working with our community agencies that are part of the source, which is the center that I mentioned earlier, that promotes service learning across the university, different schools, then assign these students to each of these different participating community agencies across the state. And then our students learn how to do service, community service, but then for their hours, they get paid. So I will say this is great opportunities for our students. So part of it, we require as part of the coursework because we really feel the need for our students to understand social justice and other health equity framework as part of their coursework. However, afterwards, there are ample opportunities for our students to jump in as long as they maintain their focus in the area.
Especially during this time with the pandemic, the nursing profession has been at the forefront and been highlighted in our world and society and culture. A question from Neil is, for participants that later go on to be students, have you seen a difference in how they think of nursing?
Difference recently during COVID, do you mean?
Or just in general too, or how it may be related to how nursing has been really highlighted at the forefront?
Well, I'll start with that. I think, we thought we might have a decreased coming class this fall. We thought that with all the stresses and with seeing what nurses are doing, but we had a bigger enrollment. And so there's people who run away from a crisis and people who run towards it. And I think a lot of people were really inspired by seeing what nursing could do. Also, listeners may not know that currently, COVID or not, 4 out of every 10 nurses in the country do not work in hospitals. So, we tend to think of, someone in a hospital on a unit going down a hall back and forth, but that's only true of 6 out of 10 nurses in this country. And the other 4 out of 10 are in schools, they're in communities, they're going door to door, they're visiting new mothers, they're at minute clinics, and other kind of clinics in drugstores. And so the range of things that nurses do is much broader than the media or other, the way we might think about it. The other thing I want to say is that more and more men are going into nursing. And this is important because it's a wonderful career and it should really be open to anybody. It's a fantastic combination of heart and head, where it takes emotional intelligence and more classic intelligence to be able to be a good nurse. And nursing is an incredible platform for being able to change the world on an individual or family or population level. So we encourage everyone to apply from whatever background one's from.
Absolutely, Dean. And yes, it's a very honorable profession, nursing is, and we're definitely, as a culture and a society, can definitely come appreciate that more. It was mentioned earlier about the strong partnership with the state of Maryland and with Johns Hopkins and the impact it's having throughout the entire state and actually across the world too. A question from Sydney is, does the program go beyond Baltimore City?
So I'm not sure which program, but here it looks like you're going to respond and then I can respond about Capable also.
Sure. So many of our programs that we focus right now are centered around a Baltimore City area. However, some other programs such as a Birth Companion, because we get requests from different systems and our partners, including the International Rescue Committee as well. So our clients come from everywhere, including DC and further down to the areas close to Northern Virginia area as well. So I will say our current focus much is centered around city area. However, we also get our clients across the different regions in the state of Maryland.
And I'll answer for Capable that so the strongest, the biggest program for Capable is in Baltimore City, but for Habitat for Humanity Metro Maryland, which is in Silver Spring, has a Capable program. So does Habitat for Humanity Susquehanna, which is in Hartford County. And the Hartford County Health Department just got a big grant from HUD, the Housing and Urban Development Department of the federal government, to start a Capable program. So we're starting to see it in multiple places in the state. We're looking for the Eastern Shore, and there is a lot of older adults there who are wanting to age independently in the community. And and then beyond Maryland, there's also Capable programs in 23 states, including Alaska and California. We're working on Nevada. They're all over. But in terms of Maryland, it is not just Baltimore. It's Silver Spring and Hartford County as well.
Right. And nurses have been at the front lines and also making sacrifices, and their families have made sacrifices for us, and especially during these times. On a local level, more global level, what can we do to support nurses at this time? And this question is for Margaret.
That's a great question. I think talking it up as a career and getting people to go into it. At the beginning of COVID, there were a lot of pizzas being sent to emergency rooms, and that was nice. But I think the more structural change and systemic change would be more lasting. So, making sure that there's state funding and other ways to support student scholarships and faculty loan repayment, the way I mentioned, and also to have anyone who is smart in your life, tell them to consider becoming a nurse.
Thank you, Dean. Dr. Han, did you want to add anything to that?
Yeah, I think at the school level, we offer some funds to underserved first-generation students, especially those from the city of Baltimore. However, as Dr. Szanton mentioned, some scholarship funding to promote students considering nursing as their future career. If there is any scholarship funding for those potential future nurses, that's going to be a great way to maintain the pipeline and grow the workforce. We hear and see a lot of nurses actually retiring early, mainly because of some of the COVID pandemic related issues and moral injuries that we hear through different news media every day. And I think refueling new nurse workforce is another way to actually address the current issue through this type of additional support.
Great. Well, thank you so much to all the viewers who submitted questions, and special thank you to Dr. Szanton and Dr. Han for their time this afternoon and for providing a thorough and informative overview of the School of Nursing. As a representative of the Maryland General Assembly and the House Appropriations Committee, and as an alum of a independent university in Maryland, I'm very proud to have this institution and these programs available to all Marylanders. Also appreciated learning about this unique part of Johns Hopkins enterprise, and I'm thankful for the investment the institution is making to allow Marylanders to lead in this field. I also like to thank those who turned to listen to the conversation in the showcase series. As we saw from this conversation, that more and more diverse segments of our population are getting into nursing and seeing how really is an honorable profession and career and can really help and change lives and help save lives in the world. So Johns Hopkins Government and Community Affairs team, thank you so much for hosting this. And we look forward to having them host more of these events in the future and highlighting your institution relationship with the state of Maryland. And for any questions that any viewers may have, please email gca@jhu.edu. Again, thank you so much for Dr. Szanton and Dr. Han for being on this panel and this conversation. And thank you to all the viewers. Have a great day.
Thank you.
Thank you so much.